to be here today because I'm a mother of 2 girls. I've had 2 vaginal births, and I really wish I knew the information that I'm about to share with you today back when I had my kids. I think it would have eliminated a lot of my pain and suffering. So without further ado, we're going to get started. And as Kristen mentioned before, we're going to have to mute all of you because of the background noise. But if you have any questions, please feel free to type them in the little chat icon in the bottom center of the page, and I will take up questions periodically. Okay, so I'm going to share the screen with you. 1 second here. Okay. All right. So before we begin, I just want to say that the information that I'm going to present is for general information only, and it does not replace medical advice, diagnosis, or treatment. For today, we're going to cover pelvic floor care postpartum, abdominal muscles recovery, return to exercise, and return to penetrative sex. So first, we're going to talk about pelvic floor care postpartum. So as you can imagine, during a vaginal birth, the area around the vagina and the urethra gets really stretched out. It gets very strained with a vaginal birth. And in some cases, there might also be some tearing, which extends down to the perineum. The perineum, also called the perineal body, is the area between your vagina and your anus. And sometimes the tear can go down from the vagina towards the anus. And it usually happens in the center bottom, and as well as to the left and to the right of it. And sometimes we have episiotomy as well, which is an incision to help open up the vaginal, the vagina opening a little bit to let the baby come out, okay? So some of the symptoms you might have postpartum if you've had a vaginal birth are tenderness and pain, swelling, urinary and or fecal incontinence. And you might feel like your bottom is falling out, which is not a great feeling. And sometimes you might have prolapse, which is a heaviness, tampon-y feeling in your vagina. All right, so it's really important postpartum, right after you give birth, to keep this area dry and clean. Watch for signs of infection. So some of the signs are ooziness and fever and chills. And when you urinate, it might be helpful to squirt your bottom with some warm water. And this squirt bottle is usually provided by your midwife or the hospital. Also, if when you pass your bowel, it's also helpful to support or splint your perineum as the bowel comes out. And what I mean by that is you get, you fold up a couple of pieces of toilet paper and you hold it right at the perineal body through the front. So it helps to sort of prevent some of that excessive stretching in your pelvic floor, which won't feel very good postpartum. So this is a picture of a squirt bottle. Some people find it helpful to use a hand spray bidet. This costs about $70, and you can connect it right to the plumbing of your toilet. The only thing with this is you only get cold water, so it can be a little bit shocking to the bottom. But some mom who use cloth diaper, they find it really helpful to clean their cloth diaper as well. Okay. Now, another approach that you can use to help your pelvic floor recover and help with pain postpartum is something that we call the RICE principle. And this is a principle that, we use for any type of acute muscle injury in the body, like back injury, shoulder injury, knee injury. And the RICE principle stands for rest, ice, compression, and elevation. So of course, ice is going to be your friend, whether you've had a vaginal birth or a cesarean birth. You can use ice and apply it to the area that is painful. Of course, if you're going to apply it to your bottom, you might want to apply it outside of your underwear or your pants. Some moms find the padsicles really helpful. A padsicle is basically a sanitary pad that has been soaked with alcohol-free witch hazel. And I just want to emphasize the alcohol-free because alcohol witch hazel can really sting the area. And if you have some aloe gel, that would be super. But if you can't get access to alcohol-free witch hazel or aloe, then water works just fine too. So usually you would soak the pad, freeze it for at least 2 hours before you use it. And you would use it like you would a normal sanitary pad. And some moms prepare a whole bunch of these before they go into labor. So they have them right away to use when they need them postpartum. Okay. All right. So in terms of rest, this is a general rule of thumb for how much rest you should get postpartum, but it shouldn't be taken literally. Basically, it just says that, you should try to limit your mobility in your 4 weeks postpartum in order for your pelvic floor to heal. Because with mobility, it can aggravate some of the pain, as well as it can aggravate any tear or any episiotomy that you might have. So yeah, take the time to rest. Having said that, I guess it's really important to get the support and help that you need in the first few weeks in order for you to rest. I realize that for some moms, this is not really feasible if they don't have any family close by, or if they can't afford to get a postpartum doula, or during this time, it's just tricky to get support and help too. And sometimes they have toddlers that they have to care for. So then the compression becomes really key if you can't really stay in bed all day long, because what the compressive undergarment does, it helps to support your pelvic floor as well as your abdominal muscles. So the one that I really like is the Bay postpartum bloomer, because it has both functions. It supports your pelvic floor as well as your abdominals. The other one is the Hideaway, which is made by a company in Guelph. And even though it says that it's for prolapse bladder support, it actually works for any kind of pelvic floor support. Yeah, and you'd be supporting a local company as well. And I've heard very good things about it. The only thing with the Bay is that it's you can only get it in the States. It costs about $70 Canadian. So it's not exactly cheap. Yeah, that's, but it's a very good product from what I gather. Okay. All right. Next is elevation. Now of these 4 things, rest, ice, compression, and elevation, I would say that if you don't have time, then I wouldn't worry about elevation. But if you have time, then it's great, because elevation, the pelvis, helps to drain any kind of excessive fluid from your pelvis, which helps with swelling. And some people ice their bottom while they're elevating their pelvis. So you can do 2 things at once. Also, I just want to go back a little bit. I just want to go back to the icing. You can also ice while you are feeding your baby, for example. So you get 2 things done at once. Okay. All right. Constipation management is really key postpartum, because when you're constipated, you have to strain to push your bowel out, and that won't feel very good on your pelvic floor while it's still healing. So it's really important that you get that you take stool softener often. Some people take it, up to 1 week postpartum, or until their stool returns to its sort of normal condition. A squatty potty is basically a stool that you can put around your toilet to help lift your legs up. And you can Google this or look it up on YouTube. There's a great video on the squatty potty and how it helps to position the rectum in an optimal position to pass your bowel. And hydration is also really important, because with the medication that you might take during labor, and because of the fact that the labor itself is a really long event, you might get dehydrated. So that doesn't help with constipation. So make sure you hydrate a lot postpartum. What else can I say about it? Yeah, that's it. Now, for most people, they need about 2 to 3 liters of water a day, and that translates to about 8 to 12 cups of water. So probably 1 cup every hour, every waking hour. Consuming fiber in the form of lightly cooked veggies, chia, flax seeds also help. And if you're constipated, it also helps to splint or compress your perineum with the bowel movement, as I described before, like holding your perineal body with a couple of folded toilet paper. Okay, any questions? So I'm going to look at the chat screen right now. Yeah. Okay, so there's no questions, so I'm going to keep going. Okay. All right, abdominal muscles recovery. Now, during pregnancy, what happens is that as the baby gets bigger and bigger, the front of your abdominal gets more and more stretched out. And the area where it gets stretched out in the front is called the linea alba. It's basically a very thick fascia. And in some cases, when it's stretched out too much, it can also split open, causing a gap in the middle of your belly. And that's called diastasis recti. And I'll be talking about diastasis recti in a little bit. So postpartum, there are a few things that you can use to help support your abdominal muscles. One is some type of abdominal wrapping. I put this here because I put the app Wrap by Belly's Inc. here because it happens to be the one that I know about and I've heard good reviews about it. And again, the Bay Obey postpartum bloomers. And please know I'm not getting any kind of kickback from, from you buying these products. So yeah, I just happened to mention them because I've heard good things about them. The only thing about abdominal wrapping or abdominal binding is, there's no strong evidence to support the healing of diastasis recti postpartum using abdominal wrapping or binding, but I do believe that they're helpful because they help to stabilize your trunk when your abdominal muscles are really weak and stretched out from the pregnancy. So they can help to decrease the risk of you getting low back strain. The only thing you got to be careful about is that if the wrapping or the binding is too tight, it can cause a downward pressure into your pelvis. And if you're experiencing things like incontinence or prolapse is when you have that tampony feeling in your vagina, it can make this worse if it's too tight. So you want to be careful and to make sure that the wrapping of the binding is not too tight. It feels supportive, but it's not too tight. And also that it doesn't restrict movement in your rib cage, which can restrict breathing, or it doesn't restrict hip movement, which can make sit to stand or any kind of low extremity movement difficult. All right, so tips for abdominal muscles recovery. Now, I just want to say that if you have been doing some research on abdominal, on diastasis recti, there's not a lot of research or quality studies out there right now to back up most of the mainstream information that you might read online about diastasis recti, which is, that gapping in the middle of your abdominals. And from the mainstream perspective, there's a lot of emphasis on closing the gap. But new research has shown that closing the gap does not necessarily translate to your deep abdominal muscles being recruited or being activated. And as a result, because the activation of deep muscles are actually really key to regaining function and strength in your abdominal muscles, the experts in the field are saying that maybe, instead of putting so much emphasis on closing the gap, the emphasis should be on activating the deep core muscles and achieving functional goals. So for example, a functional goal would be being able to lift your baby carrier without back pain. Another mainstream perspective that you might read a lot about is exercise, avoiding certain exercises because they can make the gap worse. Again, there's no research to back this up. So based on the little research and the little evidence that we have, we can say that you don't need to restrict your movement postpartum. There's no one exercise that can cause long-term damage to your abdominal muscles or make your gap worse. And any abdominal exercise is good, actually, especially the ones that recruit or activate your deep abdominal muscles. Now, however, if you see doming or coning, and I'm going to show you what that looks like in a second, you may want to scale back your exercise, make it less intense, or decrease the load. And if you experience symptoms of incontinence or prolapse, then practicing abdominal exercises, this is like having very tight abdominal wrapping or binding. It can sometimes exacerbate the pelvic floor issues such as incontinence and prolapse. So if that's the case, then you need to sort of coordinate your abdominal exercise with Kegels or with pelvic floor and breathing exercises. Okay. All right. So this is what doming or coning looks like. It's when you do your abdominal exercise and there's a protrusion in the midline of your belly. And as I said before, this is not the end of the world. It just means that your deep abdominal muscles are not able to withstand the load that is being imposed on it. So let's say if you're doing double leg lower and lift, you might want to change it to single leg lower and lift, or change it to having your knees bent and not going as high or not going as far to decrease this doming or coning. Because when your deep abdominal muscles are no longer able to support the stability of the trunk, you might just end up with a little bit of low back strain after you do your abdominal exercises. Okay, any questions at this point? Okay, so I'm going to check again. Okay, so no questions.
Yeah, there are a couple.
Oh, okay, sorry, I didn't see them.
Well, I've got a couple directly to me. If I'll ask one about this, but if we could also go back one, there was a great question about when to start abdominal exercises in the postpartum period.
Yeah, absolutely. And I will address that near the end in actually a few minutes. Actually, that's a great question. And sorry, I didn't say how long we should ice for, but we should ice for about 20 minutes every 2 hours postpartum.
Okay, that was the other question. Great.
Yeah. Okay. I knew the return to abdominal exercise was coming, abdominal exercise was coming. So I'm going to answer that shortly. Thank you. Okay. Where were we? Okay. There we go. Return to exercise. Oh, sorry. Okay. Return to exercise. Yeah. So I think everybody's really anxious about when they can exercise again postpartum because, we all want our pre-pregnancy shape back as soon as possible. And for some people, exercise is a way of relieving stress. So that would be a good reason too. So these are the exercises that I would recommend in the first 6 weeks postpartum. So you can start with diaphragmatic breathing right away. And, this is really helpful for just gently engaging your pelvic floor as well as your abdominal muscles, because when you practice diaphragmatic breathing, they also call on the abdominals as well as the pelvic floor in a really gentle way. All of those muscles work together. Diaphragm, pelvic floor, and abdominal muscles. They sort of work in conjunction. They activate together. So next thing is you can do some light stretching right away postpartum. The only thing that you got to be careful about is not to stretch your inner thighs, where you spread open your legs, or to do hip flexor stretching where you're going to a lunge position, because those positions might put strain on your perineum, which is trying to recover. So any kind of spinal pec stretching, neck stretching, shoulder stretching is fine, except for those. You can start doing light walks around week number 4 and onward. Because as I said before, for the first 3 weeks, you really want to just take it easy and not do anything strenuous. Then once your pelvic floor starts to feel better, once the pain and the swelling in your pelvic floor has gone away, then you can start doing some Kegels. I know on social media, you might read about, you might read on some websites that you should do Kegels, day one postpartum. And I don't believe in that, because just as having a back strain or back sprain, you wouldn't do back exercises after you injure it. And besides, when you walk to the washroom or when you walk around the house, you are getting some pelvic floor contraction. Your pelvic floor has to work to support you when you mobilize. So I don't think Kegels are necessary right away, but once your pelvic floor has healed somewhat, then you can start it. And at this point, you can also start doing some abdominal contractions. The reason why I think abdominal contractions and Kegel should be started at the same time, because as I said before, sometimes when you do abdominal contractions, it can exacerbate symptoms of incontinence and prolapse. So it's a good idea to add the Kegels in conjunction with that. And to protect your organs, it's a good idea to exhale whenever you go from sit to stand or lie to sit, because that's when intra-abdominal pressure is being exerted on your organs and your pelvic floor. Okay. All right. So my tips for returning to exercise are taking exercise snacks, doing 5 to 10 minutes of exercise. You don't need to do 20 or 30 minutes right away, because as a mom of a new baby, it's very hard to find time to find a 20 or 30 or 40 minute stretch just to exercise, and it's much more realistic to just do 5-10 minutes at a time. And actually that studies have shown that works just as well. And you can start with light, relaxing, simple strengthening exercises that combine breathing and core activation, and then progress to longer and more intense exercises. And my recommendation is to only start strenuous exercises when your body is well rested and well nourished. Because what happens is when your body is under a lot of stress, like when you have to wake up multiple times a night to tend to the baby, and let's say if you're so busy, you may not be able to get the most nourishment. In those cases, your muscles are probably not in the greatest condition to do exercises that require speed, strength, and high impact activities. So they're more likely to get injured, which would not be helpful to you. And I think science also shows that when your body is under stress, really strenuous exercise can add stress to your body, which encourages your body to retain fat instead of burning it. So yeah, it's a good idea to just take it easy and not go too crazy with exercises when you're not getting that much rest. Okay. All right. Now everybody's different. Everybody's unique, and you will probably all heal differently. And some people might be able to return to exercise sooner than others. It's a good idea to listen to your body and see what's going on. And see what your body needs and what it can handle. But let's say if you return to doing Kegels or abdominal exercises or any form of exercise, and you notice an increased heaviness in your pelvic floor, then it's probably time to scale back and not do as much, or stop doing the exercise, put a pause button on it for a few weeks, and then try it again. Or if you see an increase in bleeding, also called lochia, or if your bleeding has stopped and now it has returned, that also means that you're probably doing a little bit too much, and it's time to scale back. And as I said before, doming and coning of the abdominals means that the exercises are too much for the deep abdominals to handle. Okay, return to penetrative sex. Okay, now, Oh, sorry, I forgot to go back there. Are there questions?
Yeah, there's a good one. Just a question about whether deep breathing or core breath, is that the same as doing Kegels?
Yeah, no, it's not quite the same. I mean, it gently, very, very gently activates your pelvic floor and your abdominal, but it's definitely not the same as doing Kegels at all. No, doing Kegels is much more intentional, whereas the diaphragmatic breathing is more like just activating the automatic reflex of the body to very gently activate those areas. Yeah. Okay. And sometimes in some cases, sorry, I should have mentioned this, is we lose the ability to activate our pelvic floor and our abdominals after pregnancy and after childbirth. So that's something that, you know, we work on retraining women with postpartum. Okay.
And one more question. When should women see a pelvic physio post-birth?
So I'm going to answer that at the end of the presentation. So yeah, just sit tight. But it's usually around, some people say 6 weeks once the pelvic floor has healed. In my personal experience, it's usually 8 weeks or 10 weeks.
And Mia, from my perspective, I often leave it up. I'll just start my video there. I often leave it up to the client and say that if you're concerned about anything and you're really experiencing a fair bit of urinary incontinence or fecal incontinence, lots of pain, that there's no reason to wait 6 weeks either. So some women I find come back earlier and we get started on things, and that may or may not include that internal assessment, but it's a good way just to have a guiding hand well before that 6-week mark.
Yeah, that's a great idea. Thanks for that.
No problem. I'll let you continue.
Yeah, no problem. Okay. All right. So there's some indicators that you are ready to return to penetrative sex. First thing is that you go for your checkup around 6 to 8 weeks, and your healthcare provider says that your pelvic floor is healed. Secondly is that if you or your partner palpate or stretch the area around your vaginal opening on your perineal body or your perineum, that there's no pain. And when you actually feel like doing it, because for a lot of moms, you know, since they spend all day with their baby, they feel quite touched out, and intimacy is the last thing that they want. So okay. So there's some risk factors for pain with penetrative sex, but first of all, statistically speaking, 40 to 50% of women have pain with penetrative sex 3 months postpartum. And research also shows us that if you have pain with sex 3 months postpartum, chances are you are going to have pain with sex at 1 year postpartum. So if this is the case for you, then I highly encourage you to be proactive about getting help. Now, the risk factors for pain with sex are if you have scar tissue from tearing or your episiotomy, you could have pain because of vaginal dryness. And this can happen because when you breastfeed your baby, the hormones in your body changes, and it can lead to, you know,
let him be awake so that later.
Hello? So it can lead to the thinning of the vulva, as well of the tissue around the vulva, as well as dryness in your vagina. And some people are prone to hypertonicity or overactive pelvic floor, which can cause pain with sex. Now, pelvic girdle imbalance, interestingly, I had a mom coming in with this issue, and it turned out that her issue had nothing to do with her pelvic floor. It was her hip that was causing this problem. So, you know, pelvic floor pain with sex doesn't necessarily mean you've got a pelvic floor issue. Okay, so if you've had pelvic floor trauma from your birthing experience or from past experience, it can cause pain as well. And stress. Stress, interestingly, it sort of puts your nervous system in an upregulated state. And since pain has to do with the nervous system, you know, when you feel stress, it can exacerbate the pain in your perineal area when you have sex. All right, so my tips for reducing pain with sex is to use lots and lots of lube. And by lube, I mean something that doesn't have any kind of sparkle, tingling sensation, warming sensation in it, because those things tend to cause an imbalance in pH level, as well as disrupt the vaginal flora, and it can disrupt your hormones too. So the one that I really like is a water-based lubricant. It's called Good Clean Love. It's a green bottle, and you can get it at Shoppers. And yeah, it's vegan. It doesn't have anything funky in it. So that's what I would recommend. Some people use coconut oil, almond oil, or castor, and that's okay too. But coconut oil can be antibacterial, which can disrupt your vaginal flora. Okay. You can also try perineal massage, massaging that area just like you did for prepartum, for childbirth preparation. And if you're not sure what this is, we did a prepartum video back in November, I think, and it's on the Blueberry YouTube channel. So please review that if you're not sure how to do this. Relaxation techniques like massage, breathing, music, all help to get your body warmed up. So lots of foreplay. Yeah, wham, bam, thank you, ma'am. It doesn't really work well when you have pain with sex. Yeah, baby crying in the next room. Yeah, that doesn't really work well. And resolving any emotional conflict with your partner, because yeah, when you are caring for a newborn, I find that there's usually a lot of friction in in the division of responsibility between partners. So resolving emotional conflicts with your partner will also help to facilitate the penetrative sex. Okay. All right. So when to see a pelvic health physio? Yes, as Kristen mentioned before, if you have really bad urinary fecal incontinence, then you're welcome to come and see us at any time. But if it's not a big issue, but you're still having incontinence or bladder control issues or prolapse 2 months postpartum, if you're having pain with penetrative sex 3 months postpartum, if you're having low back pain, hip pain, pubic bone pain at any point postpartum, or if you'd like to start strengthening the core, but you're not sure how to progress the exercises, then yeah, please come and see us. Okay. All right. My final thought about this whole postpartum healing business is, if you can, get as much support and help as possible in the first trimester postpartum. And just keep in mind that it took 9 months for you to get to where you are. So it's going to take around 9 to 18 months for your body to return to your pre-pregnancy shape. And try to listen to your body and be patient and be kind to yourself, and don't feel pressure by any kind of expectations that you should look a certain way in a certain time frame. And I totally stole this from this Instagram account called Not Mother Goose. But basically she's saying that society glorifies women who snap back to their pre-baby weight instead of valuing positive self-body image regardless of size. And there are very few real images of what a postpartum body looks like. So we form unrealistic expectations of ourselves. And yeah, I think that's the trouble with images that we see in social media, that rarely ever do we see realistic images. So it's not very healthy. Okay, so I just want to say thank you again for spending your valuable time tonight to listen to this. I hope that this information helps you have a better postpartum period. And I realize that motherhood is not easy. So yeah, just take it easy and be patient and kind. And I just want to say thank you to Kristen for getting this presentation going and for being so encouraging all the time to the pelvic physios, or all the people who work at Blueberry, yeah, to be the best that we can be. So thank you, Kristen. And also I want to say thank you to my friend Lara Stewart-Panko at Hypnobirthing Hamilton for reviewing this presentation with me and giving me some feedback. All right, so I'm going to take up some more questions again. Well, actually, if you don't feel like posting the question here, please feel free to email me at miapelvicphysio gmail.com. Okay, so I'm going to stop this right now. Yeah, any more questions? Okay, oh, when should you start perineal massage? After birth, if you had stitches. Yeah, I don't think you should start perineal massage until your tissue has healed, and that's usually around 6 to 8 weeks postpartum. And to be honest, I feel a lot of women have trouble touching this area postpartum, you know, especially if they've had a lot of pain. So that's when they come in to see us, yeah, to help them with the perineal massage piece. But yeah, it shouldn't happen until it has healed. And usually this is around 6, 8, or 10 weeks. Yeah. Yeah. Do you have any comment about that, Kristen?
I agree. You want the tissue to be really nicely healed. And frankly, I mean, when you're talking about perineal massage in the postpartum period, we're often talking about kind of softening tissue that's healed.
Right.
Expectation of potentially having penetrative sex. And until those stitches are really nicely healed, most people are not even in any mindset.
Right.
So I think it is person dependent, but when we think about tissue healing, there's a ton of healing that happens in the first 4 to 6 weeks, but really good solid healing might be, you know, closer to 8, 10, 12 weeks even.
Yeah, I totally agree. Yeah. And there are many levels of healing, like you said. Sometimes the tissue looks good, but the pain is still there. Now, there's a question about a copy of the recording. Yeah, we will post the recording this by the end of the week.
And you know what I'll do? I have everyone's email who signed up for this. So as a group, I will send the link, but it will be on the Blueberry Therapy YouTube site. Okay.
Yeah.
But I can send it via email as well.
Yep. Yeah. Yeah. So, yeah, does anybody else have any questions?
Oh, there's a few more. Just let me look here. When is it safe to get pregnant the second time around, and how much time should you wait for your body to heal?
Wow, that's a great question, and I don't know if I have the right answer to this. Yeah, I think that totally depends on you, right, and how you feel. Because for some people, they're ready 3 months postpartum, but for some people, it takes a lot longer. But if you're looking for a timeline, I would say that maybe it's a good idea for your pelvic floor to heal and regain its full function, and that you have, you know, yeah. Any comment, Kristen?
I think some, when we talk to some of the obstetricians, they often even say, you know, as exactly as you said, that it takes 9 months to get pregnant, that there's a ton of healing happens to your own body in the first 9 to 18 months. And so lots of obstetricians will say like 2 years often. So that's not getting pregnant, but having kids 2 years apart does give the body time to heal. It gives you time for your hormones to reset potentially after you stop breastfeeding. You know, if you get the full year, it even so I think sometimes they'll say a little longer than people expect. And then if there's been anything happened internally with the delivery, or they're concerned post a C-section, sometimes they'll give very specific recommendations about how long to wait.
Yeah, great. Yeah, thank you for that, because I really didn't have that idea. Yeah. Okay, other questions?
Just could you repeat the ICE information? The person missed it.
Yeah, so the ICE information is you can ICE for 20 minutes every 2 hours postpartum, and you can apply ice, you know, outside of your underwear or your pants while you're feeding your baby, or you can use a patsicle where you soak a patsicle, I mean a sanitary pad, with either water or alcohol-free witch hazel and aloe gel, and then freeze the pad for at least 2 hours before you use it.
That's great. Mia, could seeing a pelvic floor physio help with constipation more than 6 months postpartum?
Yeah, definitely. definitely, because when people are constipated, they can come in anytime. And constipation is actually really an issue that we really need to resolve for good pelvic health. Because when you're constipated, as I said before, you strain your pelvic floor, which is not great postpartum. And also when you're constipated, there's very little space between your bladder as well as your uterus, vagina, and your rectum. So when you're constipated, all of that bowel gets sort of jammed up in there, and it's not really healthy for the other organs either. So it's good to get that resolved, and we can help you anytime with that.
And one of the things that we see all the time, Mia, I'm sure you see this, is that a lot of women in the postpartum period have GI dysfunction and distress. So whether it be constipation or bloating or just not feeling like yourself, that's really common. And we know it's from a whole series of things. Our hormones are upside down. We're not sleeping. We're stressed. Our whole GI tract has been floating up under the ribs when we were pregnant, and now it's flopped back down.
Right?
And our abdominal
situation, right? All of a sudden.
There's so many things that we talk about in the postpartum period to help with all kinds of GI stuff.
Yeah, definitely.
Here's another one. Are there exercises or strategies to help knit back the muscles with diastasis recti?
Yeah, so as I said before, I think according to the research, actually any exercise is good, but especially the ones that, recruit your deep abdominal muscles, your transversus abdominis. So, I mean, there's no one magic exercise. I think also it depends on you. And so when you come in for your assessment, so what we do is we try out different exercises and see which ones help you the best to activate and recruit those muscles.
So the bottom line to that one, as the business owner, is come make an appointment and find out. But there's no
ulterior motive.
I know, but there are really good exercises, and know that you can have really good core stability afterwards with just a little bit of guidance.
Right.
Okay, a few more. Are hot tubs or hot baths not encouraged during recovery?
Probably not too hot. I mean, some people do sitz bath 5 or 6 days after postpartum. So the first 5, 6, or 7 days, you can ice your bottom, but then after that, you can do sitz bath, and it should be warm. It shouldn't be hot. It shouldn't be hot because if your bottom is already inflamed and swollen, I mean, the heat is definitely not going to help. So you don't need to take like ice cold bath, but something that's lukewarm that feels comfortable to your body is helpful.
Yeah. Should you start taking stool softeners right after birth?
Yes, you should. Yeah. And they usually at the hospital or with your midwife, they encourage you to take it right away.
Yeah. And there's some really simple ones that you can get over the counter at Shoppers Drug Mart, like Restorelax, osmotic laxatives that just help keep the stool softer as it comes through.
Definitely. And yeah, I mean, it's amazing how difficult the bowel movement can be postpartum. It can be kind of scary, actually. So the stool softener is a lifesaver.
Mia, is there a length of time we should icing daily? I think we went over that.
Yeah.
Daily for about, I think the question is more about for the first week, for the first 2 weeks, for the first 4, what would you suggest?
For icing, I would say at least for the first 5 days and up to a week. Once the swelling and the pain have gone down, then you can start doing other things. But, as long as it helps, I don't see any problem to why you shouldn't ice, right? I mean, as long as it feels good to your bottom, there's no contraindication per se.
After you've been given the go ahead, as in your pelvic floor has appeared to have healed, when would you recommend returning to more high impact activity like running or jumping?
Yeah, so that's a great question. And, as I said before, in my opinion, at least for the first 6 to 8 weeks postpartum, you should refrain from high impact activity. Some people even say, first trimester, you shouldn't do any high impact activities. But also it depends on your conditioning, right? Like, are you feeling well rested? Are you feeling well nourished, because you know, if your muscles are not in the best shape, if you're not well rested, your muscles are not going to be in the best shape for high impact or, you know, high conditioning like CrossFit type of stuff. So you might end up injuring yourself in the process.
I think there's actually a really good consensus guideline on return to running. And exactly as Mia said, it takes into account a lot of different things. So even if your pelvic floor seems really good, as Mia mentioned, if you are not sleeping, you don't have enough nutrition in you, now your breasts have grown 3 sizes and you need to buy new bras or double up. So some of those things that it takes into account. And you know what? I'll put those return in the email. I'll include that return to run guideline because it was designed by a bunch of physios to be used both with physios, but with clients too. So it's a bit of a longer read, but great information. And their bottom line was almost everyone should wait at least 12 weeks just to let your body heal. So that's specifically jumping, running, that kind of stuff. Not to say you can't get moving again, but the jumping.
Yeah. And I just want to point out that some people have no incontinence sign until they start jumping and doing high impact activities. And if that's the case, then, you know, we can show you what to do with your pelvic floor coordination as well as your breathing to help with that.
Just a quick question that I'll answer is pelvic floor physio covered by all extended benefits that include physio. As long as you have physiotherapy, we're covered. It's all part and parcel. And whether you come see us at Blueberry, which we would love, or if you go see another pelvic physio, you can find out if they have the qualifications, have rostered under pelvic physio specifically by going to the College of Physiotherapists of Ontario. And they have to have that in order to call themselves pelvic health physiotherapists.
Yep.
Mia, there's a couple questions about sit baths. Can you talk about sit baths? And I saw another one. When would you start sit baths after icing before? That's just questions. How often should you do them?
So in terms of the sitz bath, you can do it, like as I said, after 5 to 7 days postpartum. And you can either sit in a bathtub, you know, with about 1 to 2 inches of water. It doesn't have to be like a bathtub full of water. And you can buy sitz herbs at a store like Barefoot Babies in Hamilton on Ottawa Street. You can get them online. Some people just drop a bag of chamomile tea in the bath. That works too. Now, if you check online, you might be able to find sitz bath bowls that you can put over your toilet. So then you don't have to waste as much water, and then you can put the sitz herbs in there. In terms of frequency, I would say once every 2 days is probably okay. What do you think, Kristen, in terms of frequency? I mean, I would say once.
Yeah, some of my patients will use them like daily for a couple days when things are really irritated. Again, it's kind of like the ice. There's no real harm in using them. If it feels good, then go ahead. And then as things start to heal, then taper off, as Mia, you said, every couple days, every 3 days, and then eventually you're not having to use them. I think those are all the chat questions. Mia, can I ask a couple?
Sure, yeah.
I wanted to say, like, such good information and so many of the things that our clients ask. So thank you. That was
amazing. My pleasure.
Good Clean Love, you mentioned it. It's a lovely lubricant. And what we heard from one of the gynecologists that came and spoke with us before is it also is pH balanced. And do you have clients talk to you about that, about maintaining pH balance and the value of that?
Yeah, no, I think I would say that the value of that is if you're prone to things like urinary tract infection, it becomes really key to get your pH level balance as well as your flora balance, because if you're prone to infections, that's really key.
And I also really like the comment about when it comes to sex, and whether it's just intimacy or penetrative sex, making sure that that emotional connection is there. And lots of times with my clients, I say, you know, sex is so multifactorial that our body may be feeling a bit better, but you know, we're all touched out, you mentioned, or we may be disconnected from our partner. And so, you know, just feeling like it's the right time is important. And we also know the hormones we produce in the postnatal period just tank our libido, right? And so sometimes it's a little more effort than it was previously, right?
Oh yeah, so this comes back to the previous question about when you should have a baby again. Sometimes I think when our hormones tank like that, it's sort of nature's way of saying, you know what, maybe it's not time to have another baby. Yeah, maybe to wait until your hormones get regulated and you're feeling up to it again.
One other thing that the people on this seminar should know is that we, as pelvic physios, can also do ultrasound for blocked milk ducts. Okay,
Right.
so
Yeah.
so if that's something that's coming up in the postpartum period, you know, you sense a hard area in your breast, it can get a little red, a little tender. You notice that the baby's having more difficulty using that side. Coming in to do, you know, a quick 10-minute ultrasound to try and clear out that duct before it becomes mastitis, where you have full body symptoms, infection, fever. That can be a nice thing that we could offer as well, and that we do offer currently.
And also what I find with block duct is that, you know, I think lactation consultants can show moms how to breastfeed their babies in different positions so that it clears the milk from different part of the breast as well. Because then you just breastfeed in one position, sometimes, you know, that that sort of increases the risk for the breast milk being blocked in one area. Whereas if you breastfeed sitting, breastfeed lying down on your side, lying down your back, then you get the milk drainage from different part of the breast. And I think the lactation consultants are really good at showing you those things.
Yeah, and I think too, beyond your position, but that's a great strategy to move around. It could be because the baby has a little bit of torticollis, has a little bit of tongue tie. So sometimes there are maternal factors that result in blocked ducts, and sometimes there are child factors, and sometimes it's a combination thereof. So
yeah. And being in the different positions, it also helps with low back strain, because let's say if you're always sitting to, you know, crouching forward to feed your baby, that's one of the risk factors for low back pain.
Just a quick question. So the ultrasound basically uses the sound waves to bounce around the tissue, and the whole goal is to help break down that little blocked area and clear the blocked duct. So we'll have women do the ultrasound and then immediately either pump or feed their baby to try and actually clear it out.
Yeah.
And then there was another question. Is it possible to test your pH balance or flora?
Yeah, that's a great question.
There are test strips actually. And some of the physios, the pelvic physios it's a great question. Some of the pelvic physios in the States have them in their office and will test.
Yeah.
It's something I should look into to see if, you know, it's within scope, because what we know is that when we are in the postnatal period, when we are in the postpartum period, changes in estrogen change the type of flora and fauna, and that also changes the pH, which puts us at higher risk for UTIs. And so there are products that we can use. There are ways of helping to reboot that pH. So that's a great question.
Yeah, I think when you go to your OB or your OB-GYN, they can test out your flora. Let's say if you're very prone to is it bacterial vaginismus, then they will see if the bacteria is off.
Yeah.
Yeah.
Another great comment from one of our amazing physios online. So we have a few of our physios on, but I'm going to just read this out. So Meg says, when it comes to having sex, I always say to patients that it's easier said than done, but be as into it on your end as possible. Don't do it because you feel guilty about it.
Yeah.
And if you're nervous or anxious, that's a point where we find that the pelvic floor can kind of tense up.
Right.
and you guard, especially if you're anticipating pain. And then that's an instance where we can kind of cause our own pain a little bit. So if you're feeling anxious, then it's much better just to say, hey, let's do some other stuff and leave the penetration out of it. Yeah.
Yeah. No, that's a great comment. Thanks, Meg. Anything else?
I don't see anything else. Did anybody else want to either verbally ask or through the chat? We just have another minute before 9. I think we're good. Those have been amazing questions all around. Thank you so much, everyone, for keeping this really interactive. And Mia, thank you. That was an amazing talk.
Yeah, my pleasure. Thank you for being my co-host and for answering some of the questions I didn't know. Yeah,
no problem. That's why Blueberry Therapy is such a great place, because we have so many great minds and people to kind of pick each other's brain. And I think it keeps us honest, Mia. So that's good. So we are having another talk on, I know Deidre's on the call too, but later this month on, hello Deidre, is it the 24th, Wednesday the 24th, on gross motor milestones in children? Oh,
Yes,
is it the 24th?
Yeah.
Yeah.
Can you hear me? Sorry.
So the 24th, again, from 8 p.m. to 9 p.m. So if you've already had this little baby and are interested in what happens over the first year, come and listen to Deidre, and she's going to tell us everything that she knows in an hour. Okay. Thanks so much, everyone. Have a fabulous night.
Good night.
Night.